Hello, John Muir and Joan Evans from the Communication Skills Programme, back again to deal with some communication skills in Med 1. This time we're going to be talking about emotions in the medical interview. There are 2 or 3 sessions over that we're going to be dealing with. Firstly, we have a plenary that we give. The plenary consists of various aspects of emotions. In fact, it's one of the most enjoyable and fun plenaries in the entire medical school calendar, we're told by our students. And you're certainly welcome to attend this plenary. We deal with some of the emotional issues, some aspects of empathy, aspects of the angry patient, breaking bad news, although we're not expecting these students to be learning all about breaking bad news now. It's just that they've asked to be given some of the basics in case they find themselves in that situation. So we deal with it now, although of course the main sessions on breaking bad news occur in Peer 1 in Med 3. We also hand out our teaching cards on both the angry patient and breaking bad news at this session. And lastly, at this session, we do some boundary issues for the students as well. It's rather a long session, but as I said, very much a fun session. Joan, did you have anything to comment?
Yes, thanks. Just to set the foundation that this is not, as John mentioned, about teaching our students how to break bad news. It's really teaching them how to connect supportively and empathetically with patients who are experiencing emotion that would be characteristic of a lot of scenarios and interactions with patients. And breaking bad news, disclosing adverse events, those are just some of the challenging communications that students are going to be learning a little later in their education. And understanding emotion is probably the foundational piece. And in regards to boundaries, they are going to be getting boundary discussions in the context of their ProComp unit. However, we're looking at it from an emotional perspective. Like when boundaries are violated or encroached, there's a discomfort. And how does the learner manage that discomfort? How do they still manage to maintain a therapeutic communication with a patient when they may need to be setting limits and still managing their own emotion? So that's essentially what we're attempting to do in this plenary.
Following the plenary in a subsequent week, there's a session in the LRC, very similar to the sessions at the start of the term, communication skills sessions, with a format of a tutorial, some practice interview stations. There is a difference, however, from the early ones in that the tutors are mainly present only for the introductory tutorial. The students then, when they go through the practice stations, are videotaped. And those are the video recordings that they're going to take, do an assessment on, and you'll see them in a subsequent session to review one of their tapes and make comments on it. So the LRC session is set up to begin, starting with a tutorial. And that tutorial is a bit like the tutorial in the very first of the communication skills weeks, where you'll have your students, your 4 students. You'll also have an SP in the room and yourself. It's an hour-long session, but halfway through, there'll be a knock on the door. The SP that's in the room will be dragged out, and a new SP will be put in the room. So we're hoping that you'll be able to get the students to do an interview with the SP. There will be emotional content to that interview. Please plan for a good time for feedback on that interview. It usually generates a lot of comment from the students, as well as from the tutors and from the SP. And then, as I say, halfway through, new SP in, another interview, another set of feedback. It's useful sometimes to have one of the students actually checking their watch so that they can sort of say, it's time, it's time that we switch, so you make sure you get everything through there.
And the main purpose of this introductory tutorial is to really be the icebreaker to help students relax and to take away some of the fear factor in talking with a patient who may respond with a lot of emotion. So the 2 patients that are going to be interacting with your students in this first tutorial are really there for fairly innocent reasons. You've got an Alana Georges who comes in for a well woman checkup, so the student is going to be asked to take a history. And in the context of that history, some emotional issues are going to surface, and the learner will have an opportunity to respond empathetically to that patient. Likewise, the second patient, or perhaps the first, depending on the order in your own room, is John Zivick, a young man who comes in complaining of a stomach problem. Again, the instruction to the student is to just take a history, and how it unfolds then can be somewhat unpredictable. And I should ask that you remember, and all of the learners remember, to support the student who is in that interviewer role and to learn from it. They're only offering the experience, so not all of the feedback needs to be directed to you could have, you should have, but to remember what the real rules of effective feedback are. So let's not use the should word. What is effective? What is less effective? And if I was in that role, what might I have said differently? If we were in that role, what could we say differently, perhaps, just to frame it positively?
And in the feedback, even being empathetic to the interviewer. We're hoping the interviewers can be empathetic to the patients, but sometimes in these emotional circumstances, it helps, just to give your feedback in an empathetic manner to the interviewer.
And speaking of feedback, sorry, John, if I can just talk about the order, because it's a little different here. So we're going to ask that the student interviewer we always start with them. How do you feel that went? Where do you think it went well? Where do you think you could use some help? And then the second one is to ask the patient. And normally we don't do this, but once the simulated patient has had a chance to offer their feedback, then the discussion comes back to your full group, and you can still involve that SP as needed.
Because it's a bigger group, isn't it?
Exactly.
It's not that they're just one student who may feel intimidated and not giving you the information. You've got a bigger group, and this will bring out feedback from almost all of the students.
Yeah, exactly. And sometimes the interviews don't last very long themselves, but the discussion could be very rich.
Discussion can be very important here.
And if that interview only lasts a few minutes, and someone else in the group, another student would like to have a try at it, or your same student would like to have another go at it, based on some of the feedback, then we encourage that, provided you can do that within your 25 to 30 minute time frame.
Okay. Subsequent to this session, tutors are free to leave, although you're certainly invited to remain if you wish to, and you'll be able to observe your students using the closed circuit TV system in the LRC, because during the subsequent session, the students are going to rotate through 4 stations, just as they do at other sessions. There will be the student and a colleague in the room with the SP. Those sessions are going to be video recorded. After the session is over, the students will be receiving their video recordings within the next day or two after the session. And they're then going to be asked to review their recordings, choose one of them, write an assessment on it. Now, the assessment's fairly simple. It's asking for 3 things they think they did well and 3 things that they think did not go so well. That's basically all they're being asked for. And they're going to bring that review back to you at the subsequent video review session to look at and see. For your advice, this is the one time that we do ask the tutors to be involved in patient self-assessment in the Med 1 communication skills part. Sorry, in the learner self-assessment in the Med 1 part. And what we're going to be asking you to do when you come there, and I'll be speaking about this further, is to look at the assessment that the student has produced along with their video that you'll be reviewing. They may have had a horrible interview. That's not what we're judging. We're not judging the interview. What we want to make sure is that they've been able to assess appropriately and not just fill in the few details that the SP gave them or something like that. We want them to have thought and looked at this and looked at their performance. So if they've got a horrendous interview, but they've been able to say why it was horrendous and what the good things were, that's what we really want to hear. If they've done a brilliant interview, but they can't tell us why it was brilliant, or they can't tell us, maybe the 1 or 2 things that weren't so good, then that's not really a satisfactory outcome. We'll be discussing that a bit further when we discuss the video review session.
So what we wanted to do now is just set the stage for you, because even in that first tutorial and before your students actually depart from you and you go back to your normal day, students may have questions about what they're going to be doing in the DVD review. So just to set the stage that once you leave, your students are going to rotate through 4 stations. Each student will have 2 interviews that they conduct and 2 that they observe. And they will provide feedback to their peer, and the SP will as well. So they'll run pretty much how they have in previous LRC sessions, except that the interviews are recorded. And the student will be asked to choose one of those, as John mentioned, that they will therefore analyze in detail and submit in a written format. So, and that we're going to discuss in a future John and Joan show, when learners are actually going to be engaging in the DVD review process with you in the LRC. Anything further, John?
I think that's it for there.
Great.
Thank
Thank you.